Hello, everybody. I think we are live. Welcome to this session on disability, which is very exciting. I'm going to kind of filibuster for a minute or so that we get some people as they join, which is that awkward thing that I watch Instagram people do and think this is a very silly thing for you to have to do. But apparently it is a thing to do when you are doing these things. So, right, I'm going to kick us off. We are really excited in this session to kind of be exploring two issues that interact with each other. So we've got a number of you lot here from different backgrounds. So some people from disabled people's organisations, disability charities, other funders, staff from the National Lottery Community Fund. Welcome. It's great to have you with us. We'll be discussing today two things that interact with each other. So the impact of COVID on disabled communities and disabled people, as well as how funders can better support disabled people and disabled-led organisations. And that is through the launch of an exciting piece of research that's been commissioned by the National Lottery Community Fund and written by the wonderful James Lee, who we have with us here today. We'll also be joined by a number of other guests. So we have James Lee, who's a researcher and author. James is a disabled person and works as a freelance consultant with other funders and different organisations. He's the chair of the Grants Committee for BBC Children in Need London and also sits on the advisory board for the Habinteg and Unlimited Transport for London and Greater London Authority. So a huge accolade of different kind of experiences and things to bring to the session. We've then got Sadia Nielsen, who's a consultant. She's a professional Black disabled consultant with over 30 years of experience working to promote disability equality and human rights for all disabled people. She has experience working across a wide range of professional sectors, including voluntary and public sector at local, national and international level. We're joined today by Rhiann Davis, who's a CEO of Disability Wales, and she's been in that role since 2001. Rhiann is a long-standing disability rights campaigner with a track record in developing, supporting and leading disabled people's organisations. Rhiann is a very busy woman and has, I believe, a board meeting following this session. She's going to be with us for the first half and then is going to disappear. So the way that we'll work the agenda is we'll kind of like have a presentation from James about his research, but then we'll ask some questions to Rhiann, particularly interested in kind of the Welsh perspective and moving outside of the England and London bubble, which is always very exciting. So we'll do that so that Rhiann can get on to her board meeting. We've then got Tanya, who's a programme manager for the Trust for London, Strengthening Voices, Realising Rights, which is an incredible disability initiative and an excellent example of how funders can be supporting the sector. So really exciting to hear how that's gone. Tanya has over 35 years of experience in grant making and has worked for a number of large, small and generalist specialist funders, both statutory and independent here and abroad. Over this period, Tanya's been active in migrant women's human rights organisations in the UK and has worked with civil society organisations as trustee and in an advisory capacity. So that is our panel. Welcome, everybody. Thank you so much for joining us. As I mentioned, we're going to kick off with James, who will be able to kind of give us an overview of the research that he's been doing for us and share kind of his findings and also provide some challenge and recommendations for funders in this space. So take it away, James.
Brilliant. Thank you very much, Hannah. Good morning, everybody. What I'm going to do is I'm going to spend about, I think we've allotted 15 minutes or so for me to talk through some of the key themes of the research that I've conducted. I say research, it feels almost like more of a discussion paper to me than anything else. I'll be the first person to hold my hands up and say that the sample size of organisations that I spoke to was limited due to the nature of the time available to work on the project. But I think that hopefully it serves as a good starter for a conversation that it poses some questions that I think we can all benefit from asking ourselves and our colleagues. I should also make clear that there is an easy read version of the report in the works. Due to the impact of COVID, I'm sure you'll all be well familiar with the knock-on effect to some of the organisations that we'd like to work with. But rest assured, an easy read version is out there because it's one of the things that I talk about in the report. So it'd be really hypocritical of me if I didn't also supply an easy read version of this report. But I do apologise that it's not available and ready for us to look at today. So what I'm going to do is just throw a couple of thoughts out about some of the themes from the report that really stood out to me. And I guess one of the first things I should talk about, and sorry, I should apologise also, I've got a small child sat next to me at the kitchen table. So I'm afraid there's little I can do about that. You'll have to put up with his playing with toys next to me. I'm single parenting today. But yeah, the first thing I should clarify then is why I have used the term DPO as opposed to DDPO in this. And by that, I mean disabled persons organisation versus deaf and disabled people's organisations. I'm well aware that some deaf people see deafness as a separate cultural identity, and that's why we separate it out. But it was during the course of the research when I was speaking to someone who's on the call today, but I won't identify them, who pointed out to me that we are, as a community, stronger together. We gain nothing by segregating people out. And so that really resonated with me, but I say that full in the knowledge that I am not a deaf person. I don't presume to speak for deaf people, but I just wanted to make clear that that is why I've used DPO throughout the report as opposed to DDPO. I'm very happy to be told I'm wrong. I'm very happy to be told otherwise. That's the whole point of the report, is to spark discussion. I guess the core theme of the report relates really to this concept of equity on one hand and equality on the other. So equality being this idea that we treat everyone the same way, and equity being this idea that we instead seek to treat people with fairness. And I can understand why equality has for so long been sort of the watchword of certainly funders for quite some time. It's a much easier concept to understand. Our understanding of equality is much more widely shared. It's a concept and a way of working that is far less open to interpretation than equity. I think that equality kind of feels comfortable, it feels safe. But you could also argue that this focus on equality is almost suffocating parts of civil society. So what do I mean by that? Well, if you think about equality versus equity, and forgive me here, I'm going to use the metaphor of access to a building. Let's pretend that there's a big bank with lots of money in it, and we all want to get into the bank to get some money. That's what we're doing with funders. With equality, we would all have to enter through the same doorway, whether that's up a flight of stairs or poorly signposted or whatever. With equity, we would all enter that, we would all go in and get some funding through different entrances that suit our various needs. So some people might use the stairs, some people might use a lift, some people might use a ramp, etc. That's kind of the core of what I'm trying to get across with this idea between equity and equality. And I'm well aware that when you start talking about equity, it does feel a bit like you're opening up a can of worms in a way. I mean, if we think about the finite funding that's available on an annual basis, if we then start to talk about equity, and sorry, no, can I help you in like 10 minutes? Yeah, sorry. If we start, sorry, if we talk about equity in funding, we talk about targeting specific funding programs at specific groups, at specific communities, then if it stands to reason that others are going to lose out. So if we, as funders, we often talk about this concept of surrendering power, of wanting to do more, to work with the communities that we serve. But how comfortable are we when we then need to think about asking our grantees to surrender power to other grantees? So in this instance, if we were to follow this path along, and think about equitable funding for disabled people's organizations, how comfortable are we if, and I'm not saying this necessarily would happen, but how comfortable would we be with the idea of some of the established disability charities, organizations for, not of, being the ones who lose out in that scenario? It's a hypothetical, but it's something that's worth thinking about. One of the quotes that really struck me from the report, something that was said to me by somebody from a disability charity, an organization which many people would consider to be for, not of. This person, who was a fundraiser, said to me that the problem is that we're all competing for funding, and that this creates a capitalist market in a sector where that's not supposed to exist. But it does, and the commodity there is the social value of our work. And I work.
Oh, we appear to have lost James mid-sentence. We will see whether we can get him back. In the meantime, we've got quite a few questions in the chat around the report and where you can find it. I'm going to copy that link in now so that you can see it. And there's a blog that James has written. James, carry on.
Sorry, yeah. What was I saying? So I won't start going into a whole thing about economics and capitalism and so forth. Others cover that in relation to disability far better than I do. But I guess the point I wanted to make is that if we start to talk about this in the language of economics, and we start to think about owning the means of production, where it was again put to me by somebody who I interviewed for this report that, you know, we would look unkindly on an organization that was focused on tackling, let's say, the disparity faced by young black men that was run by old white men. We would look unkindly on an organization that's focused on tackling some of the disparity faced by women in the workplace if it was run by men. So why do we not look unkindly upon organizations that tackle the disparity faced by disabled people that are not run by disabled people? I'm not saying that one is right or wrong. It's not my role here as the person who's written this report to make a value judgment on that. But it's an important question, I think, to ask ourselves as funders, as organizations, as people who work in this space. Other key themes of the report. So some of the, if we get, that's kind of some of the conceptual stuff. Sorry, I hope you'll indulge me in my rambling kind of roundabout way of trying to tackle some of the issues. But other key issues within the report. So one of the things that really struck me was the accessibility or lack of accessibility of the funding process of applying for funding. Anyone who's ever worked for a DPO or a small organization who's tried to get some funding will probably tell you the same. It feels like trying to talk another language sometimes. And I think that in particular for communities of for disabled people, that problem can be exacerbated by the lack of accessible guidance material that's out there. In particular, making reference to things like Easy Read. So I know that the lottery has been doing more in this space to try and produce more of its guidance in Easy Read. But if you look wider across the funding sector, I could only find sort of 3 pieces of guidance from other funders across the sector who have produced anything at all in Easy Read. And that was Trust for London, where we've got the wonderful Tanya joining us, and City Bridge Trust as well, who both produce their funding strategies in Easy Read. But I guess it just goes to show that when we talk about working with disabled people, it's very much coming from that point of doing to, not with. And that's evidenced by the fact that we aren't giving people the tools to co-create, to work with people who maybe are neurodiverse, who would prefer guidance materials in Easy Read format. There's very little of it out there in the funding sector, and I really hope that is something that changes. Some of the other things that really struck me from the report, I guess that there's a big issue for me there as well around the people who are making the decisions about the funding applications that we receive. This isn't a black and white issue. I'm not saying that just because you happen to be a disabled person, you understand disability, that you necessarily want to work in something that's related to disability, or that you feel comfortable talking about other people's conditions or impairments. That's absolutely not the case at all. And that was something that came through really clearly when I was talking to colleagues from within the lottery and also across the wider sector. I mean, I've been working in funding for about, oh gosh, going on 4 years now. And before working on this report, I could count on one hand and not even need to use all of my fingers the number of disabled people who I knew who were working at funders. After working on this report, I now need 2 hands, but I still have fingers to spare. There are very few disabled people who are working on, I guess, this side of the funding fence, and that has an impact on the way in which we fund. That has an impact on the decisions that we as funders make. Again, not to say that disability is necessarily just because you yourself have some form of impairment, that doesn't necessarily mean that you can talk about other people's impairments. And some of the comments that came through to me made it very clear that actually it was very uncomfortable for people when they were a disabled person working in a funding organization. That expectation of knowledge and the assumed burden of knowledge was really to their detriment. I guess that the point that I'm trying to make there is that it is important to have that voice of lived experience within your funding process, as it makes you a better funder, able to make better decisions about funding. But it's a lived experience that has to be recognized for the value that it brings, that has to be rewarded for the value that it brings. And it's something that you can't just expect people to volunteer in an unspoken way. I think there is an issue with the way that perhaps diplomatically, I think there is an issue in the way in which sometimes people who work within the voluntary sector or charity, and this runs across both funders and our grantees, there's an issue in the way in which we perceive our disabled colleagues sometimes. And I think a lot of that stems from the fact that our work around disability often revolves around this idea of... Sorry?
Repeat that.
Yeah, sorry, I've got...
Sorry, James,
small...
repeat that, please.
That's okay. Small child spilled a whole bag of crisps on the floor. I think there is an issue in the way in which colleagues on both sides of funding and in service delivery and so forth relate to our disabled colleagues. And that's largely, I think, and I'm happy to be corrected on this, but I think largely because the way in which we perceive disability in our working lives is this thing that we need to rescue people from almost. You know, I'm well conscious that I say this as the chair of something like Children in Need, chairing their grants panel, who are, yeah, I won't go into that. But I think that this notion that we need to save people from disability, that philanthropy is something that is there to alleviate the impacts of disability. When you then have a disabled colleague come and work with you, it's very hard to shift yourself from that mindset of paternalism, from that mindset of knowing better, or being the person who comes to save them from this awful affliction, or, you know, in quote marks. That for me was something that I really struggled with hearing from colleagues from across the sector, both in funders and outside of funders. I guess ultimately the last thing I should raise is whilst we're here talking about the lottery, and much of our talk will necessarily be about money, there are also lots of things that funders can do which don't necessarily relate to financial. So one of the things that was raised by almost all of the DPOs I spoke to was the value of the connections that funders can help them to facilitate, and not just to other disabled people's organizations, but to organizations in their locality, in their vicinity. One of the DPOs I spoke to, so the bit of campaigning work that they were proudest of, that had the greatest impact in challenging some of the benefit and welfare reforms that have really decimated communities across the country, was a coalition that they worked on with other organizations who were not disabled people's organizations, who were perhaps organizations that addressed issues of race or gender, but they were all united in their locality and their geography. And I think as the lottery has this emphasis on locality and geography, it's something that's worth bearing in mind. There is a huge difference you can make there just by facilitating those connections. I guess ultimately my aim was to prompt some questions, to throw a few things out at all of you to discuss. You know, being a better and more supportive funder isn't this mission that ends with a big victory banner that says job well done. It's this constant process of learning and development. And I guess whilst there's no roadmap for this work, I do think that at the core, if you have that principle of the empowerment of disabled people, then that should serve as a pretty good, I guess, guiding star for this work. Hannah, stop me before I ramble on too much longer, because I think I'm over time now.
Literally, I've just had a little message pop up from Scott saying James has got 1 minute left. So that was perfectly timed. Thank you so much. And so many really, really interesting kind of challenges for the sector, but also insights. I know James, and I suppose like we have a lot of colleagues on the call from the National Lottery Community Fund and other foundations who might be disabled who aren't necessarily talking about that. So within the lottery, we've got a disabled staff network. So if you are a disabled funder and want to get involved, come and join us. It's a lovely space and we're very nice and very kind. But I know, James, you were talking about doing some work around kind of connecting some disabled funders up. So if anybody is interested in that space, please do get in contact. I'll put my contact details in the chat. We've had some really interesting kind of comments come through. I'm trying to keep track of the conversation and the written chat and the questions, which is a feat in itself. There are other people in the fund. Laura Furness is incredible at doing this. It's a bit of a juggling act for me, so we'll see how we go. But please do put any questions that you have in that questions tab, because it means that it just highlights it to me slightly easier than me trying to track it in the chat as well. So we're going to hear from Rhiannon now from Disability Wales. But I suppose, Rhiannon, there was a couple of things that were coming up in the chat and that James has spoken to that you might want to touch on, particularly kind of these conversations around like it being really, really difficult for user-led or disabled people's organisations to get across in funding bids this nothing about us without us approach. And I want to be really, really clear, nothing about us without us is a mantra of the disabled people's movement, and that is where it originated from. It gets used in lots of different spaces, but that is the origins of that kind of mantra. And I think it's really, really difficult sometimes for organisations to kind of demonstrate that in funding bids. And I think there's something for funders in learning, actually, how do we recognise this, recognising what it means when somebody says they're a disabled people's organisation, and kind of, so there's learning from funders. But I wonder if you have anything else that you want to kind of speak to around being able to access funding as a kind of user-led organisation, and then the impact that that has on disabled people and disabled communities. I think you're on mute. You found it?
Yes, yes, thank you very much, Hannah, and delighted to be here as part of this event, and I think much needed, if not long overdue, event with a focus on funding for disabled people's organisations. In case you haven't come across Disability Wales before, we're the National Association of Disabled People's Organisations in Wales, striving for the rights and equality of all disabled people. Our core role is to represent the voice and priorities of our members, grassroots DPOs, to government. So that's primarily Welsh Government, but also UK Government, with the aim of informing and influencing policy. As the national umbrella body in Wales for DPOs, we also have a big role in supporting and building the capacity of our members. One of the challenges in Wales is that very few disabled people's organisations in Wales, have a significant funding base that enables them to, have premises, employ staff, deliver projects and services. That has been a major challenge. As an organisation, we have experience both of receiving funding and applying for funding, but also in recent years actually being a funder. Both through the drill program, which was funded initially by the Big Lottery, now that the National Lottery Community Fund. People may be familiar with drill, disability research on independent living and learning. It was a 5-year program run across the 4 nations by DPOs in each of the 4 nations, which funded distributed £3.5 million in 2 co-produced research projects co-produced with disabled people. And then also, most recently, we're part of the National Disabled People's Organisations Consortium, which received funding through the National Emergency Trust to distribute 1.1 million in grants, emergency grants to DPOs across the UK. So it has been interesting to be on both sides, of the funding table, and sort of learn the lessons from that. I mean, in terms of, I think there is a lack of recognition on the part of funders of the unique role of disabled people's organisations. I think, we have to be honest, there is a huge field of disability organisations and disability charities, many of which, provide, many of which are quite major organisations, have quite substantial, reserves and funds, and have quite a strong presence in terms of like media and comms, media and communications, etc., and can often employ professional bid writers to help with bids. And whereas for many disabled people's organisations, it tends to be grassroots, volunteer run, don't have even have 1 member of staff, let alone a grants officer. And it can be very difficult to get across, the unique role that DPOs play in their local community in being the voice of disabled people in a particular area, and often the trusted voice of disabled people. So I think when we became part of the consortium with Inclusion London, Inclusion Scotland and Disability Action Northern Ireland in distributing funding from the National Emergencies Trust, what we we were awarded that funding because we were DPOs, because there was a recognition of a lack of funding that in around COVID-19 and emergency funding that was aimed specifically at DPOs. We were clear that in developing the grant scheme and in opening it up and in assessing grants, that the social model of disability, was our starting point, because of, we recognise the barriers that disabled people face generally in society, and we needed to make sure that our DPO emergency grant scheme was delivered from a social model perspective. So that meant developing a grant scheme that was accessible, that we provide clear, accessible information in a range of formats. So the information was available in Easy Read and through BSL. We provided webinars that could talk people through the process and show the online grant application scheme, talk people through that. We also identified from the perspective of DPOs the key priorities that the emergency funding would address, one of which is independent living, which is a major policy area for DPOs as part of the UN Convention on the Rights of Disabled People, Article 19, the right to independent living. Also addressing issues around isolation and issues on income. And, we'd identified these through our own consultation and discussions with our members across the UK, that these were the priority issues facing DPOs and disabled people across the UK. We set up assessment panels in each of the 3 nations, and I think it was 8 regions across England. All of the assessment panels had representatives of disabled people's organisations, so it was like a peer support assessment process. And in terms of assessing applications, what we wanted to see demonstrated was what, the idea, the track record of the applicant in representing the voice of disabled people in their local area, whether that was from a specific impairment experience or whether it was around intersectionality. But it was about that track record and commitment and the sort of campaigning and working around the social model and the rights of disabled people. What we were less interested in was the professionalism in which the bid had been presented, we were also clear to spot where the applications were genuinely from DPOs as opposed to kind of disability charities. I think what we've learned certainly in Wales in terms of our own assessment, obviously this was a funding pot specifically aimed at disabled people's organisations, but we could see from our assessment experience that if these applications had gone forward to mainstream funders, then quite often, it's quite likely that many of those bids will just struggle to get funding. So there is a major capacity building piece of work that needs to be done around DPOs, as James has articulated. But also it's vital that funders like the National Lottery and others, I think, also address and tackle their own systems to make sure that they are accessible, that they come from a social model perspective, and are very much welcome today's session as part of this starting that conversation. Thank you.
Thanks, Rhian. That's really, really fascinating and such a different way of doing kind of like funding. And I suppose within the lottery, we're exploring kind of these types of approaches of participatory grant making and of recipients of funding being more involved in how you decide where funding goes. So you can follow that journey as well. And we'll be doing a learning session on that in the new year. Sally and Rhian, I'd like to bring you both in now at this point, because I was wondering whether there was stuff that you were seeing there that kind of demonstrates or kind of highlights some of the real impacts of COVID on disabled people, whether the stuff that we kind of as funders should be knowing, but also just more widely across the board, like what is the experience of disabled people in the kind of the face of the pandemic. Sadia, do you want to chip in at that point?
Okay. For me, thank you, Hannah, for inviting me to today, and also thank you, James, for the report. I read it and it was really good. So for me, what I think about, I listen to, can't read your name. Rhian, yeah, I thought it was Rhian. I listened to Rhian and James, and they're both talking about something that is really paramount to think about. And for me, COVID and disability and charities have, like, say, for example, for me as a person who comes from 100% philanthropy, and the impact of philanthropy on how it started as an intervention and it continued to be a way of life. Interventionism has got to have sort of a short period of time, but sadly for disabled people, because of charities for disabled people, has lived for 150 years. I remember when I was fighting for and demanding the access and also for the Disability Discrimination Act. I remember hearing people that some charities that work for disabled people celebrating 150 years. 150 years, and I haven't seen any changes apart from keeping institution and keeping disabled people in institutions. So since the discovery of the social model, and I think this is what I'm asking the funders to think about, is to give and to realize that there is a gap, the translational gap between bringing something and for that thing to be acted. because the charities, what they've done to disabled people is one of the things that we never had to negotiate our choices. We never had to say, for example, for me, since I was a year old, I was in an institution. There is no negotiation. I haven't learned negotiation. I haven't learned, I haven't learned to fight for my right, because everything is institutionalized. Then after even the say, for example, I can't call it love, but you know, that thing that pushed the mother to tap her baby to say, don't worry, I'm here. That heart that you used to hear and feel is still here, hasn't abandoned you. We don't know that. I don't know that. So that gap that exists, that transitional gap, what for me, what I ask from the funders is to come and meet me at that stage and support me. As James said, is how do you support those organizations of disabled people that are starting from no education, no inclusion, no being part negotiating the world? How do we meet them at that stage and support them in becoming where we want to be the absolute freedom that we fight for? Like, say, for example, I work for Inclusion London. Sometimes I work for Alfie. And what Alfie and Inclusion London are asking for is, it can't be numbered and it can't be explained. It's an funny for, it's a knowledge that we have as disabled people, which James has put in his report, is to acknowledge acknowledge that knowledge that can't be defined. It can't be just written. It's same as you learning to ride a bicycle and you can't explain how you ride that bicycle without falling. So those things that non-disabled people that haven't experienced our experiences can't know. It's not that I'm asking you to be to wear my shoe. You can never wear my shoe. But what I ask the funders is to be radical in their empathy. What I mean is to action, is to fill that void that they're asking for. How do we fill that void? Sorry about taking a long time.
No, that's brilliant. Thank you, Sadia, and some excellent comments from the chat, kind of really kind of backing up and saying thank you for your contributions. Rianne, I'm aware that you've got this board meeting that you need to disappear to, so if at any point you need to go, that is okay. What do you know? Are you around for a while, or are you going to have to disappear?
I'm okay for a few minutes.
Okay, perfect. I was wondering, just in case anybody didn't know on the call, whether you'd be able to kind of give an overview of kind of the social model of disability and anything else that you've kind of seen through your net applications with regards to how disabled people are experiencing the pandemic.
Sorry. Oh, so do you mean in terms of the kind of applications that we received? So we were able to fund, I think it's 94 projects across the UK. I know it's 90 plus. Applications and projects fell into a range of categories. So quite a lot were around information and advice to disabled people on a range of issues. Others were around sort of activities that would support tackle isolation, that kind of quite a few in terms of arts-based activities. Others were around supporting people with specific impairments. For example, people from neurodiverse communities or vision impairment, or people with learning difficulties. So it's really quite a widespread, and I think that was another part of our role in terms of delivering the funding, was that we wanted to make sure that the funding we were able to award actually represented the wide diversity of community amongst disabled people, so that there was funding towards, for example, projects that supported disabled people from BME communities, LGBT communities, and as well as different impairment experiences, because as we know, to be a disabled person, we face barriers in common, but we will also have specific experiences that will be unique to particular communities or identities that we have. So I think that was again, that's something that perhaps mainstream providers don't necessarily, or don't actually address or recognise.
Brilliant, thank you. Tanya, we've had a question in the panel, and I wonder if you might be able to kind of respond to this and talk maybe a little bit about the work that Trust for London have done. So the question is, the charitable mind heart set comes from a good place, but it can be damaging and disempowering to people with disabilities. As soon as you're on a program with kind of KPIs or key performance indicators, you're labelled and perceptions become embedded. How can funders address this problem? I think that links quite well into the stuff that Sadia was saying around kind of like radical empathy. But I don't think this is something you've come across through your work.
No, it is not really, hello everybody, it is not really something that has come across to our work, because we are exploring an example of what is radical empathy. And what we're trying to do is working with people who are deaf and disabled to help us inform what we're doing. So we're very much away from all these formulas and key performance indicators, and we are just trying to work with people where people happen to be. Actually, Ryan, I think that you mentioned something about expectations being placed that just not real. So for us, it's about meeting people where they happen to be, really. I don't know if that answers the question.
Yes, that's. Do you want to explain a little bit about the funding program that you run?
All right. Strengthening voices.
Can you move just slightly close to the microphone? Somebody's asked. I don't know if that's. We'll just get really close to the computer.
Strengthening Voices, Realizing Rights is an initiative set up in 2018 to address the devastating impacts of austerity cuts on deaf and disabled people who were and are experiencing increasing poverty, discrimination, and exclusion as a result of cuts. Sorry. And also to...
Sorry, Tanya, hang on 1 second.
To acknowledge... Sorry, the noise is not very good.
1 second. Nick, sorry, what was that?
Sorry, I'm having problems with noise.
Sorry, I'm just struggling to hear Tanya, so sorry.
Okay, problem with the noise. Is everybody else getting feedback on that? No? Try again, Tanya.
Right. The initiative aims to bolster the capacity of organizations led by deaf and disabled people to promote and advance equal rights and inclusion for deaf and disabled people. And in line with these aims, we have strived to co-produce every aspect of the grant-making operation. And what we have done, and basically that means the deaf and disabled people have been involved in formulating strategy, programmatic approach, our guidelines, how we present information, our monitoring and evaluation, and the capacity building support that is the package that we're giving to funded groups. It is a program in 2 phases, and we are exploring our own way of co-producing, and sometimes our way of co-producing probably somewhere around between co-producing and co-designing, really. And I think there are really issues that we are struggling with. We are learning all the time, and yet we're taking on board most of the things that have been mentioned about paying for the expertise from experience, acknowledging that the value of that experience, And I think in our case, it's been quite. We've been very lucky to be in the context of an organization which has the strengthening the voice of people with direct experience of poverty and inequality as a central plank of our strategy between 2018 and 2022. So really, we've got a very supportive organization, and it's right that for us, and I'm very lucky. I don't think any fund or any other funder has been in that situation. The deputy chair of our organization is a disabled woman who's been very active in the disability movement. So there is a kind of movement that we want to move forward, and we really, the one thing we want to do is share what we're learning with other funders, because it's been an amazing journey, and it has proven right that people that have experienced the issues, they know what is a promising approach and how best to address the problems that deaf and disabled people are encountering. It's been a great journey. I don't know if I'm presenting my presentation now or I'm answering a question. Hannah.
That's brilliant. Well, I suppose, did you have some extra things that you wanted to say? Like, feel free to kind of like say what you would like.
Well, I have been at the risk of repeating a bit what James said. I really want to dwell on something really important, is that and which many of the people who have made comments have emphasized. I think that coronavirus, I mean, what is happening out there is just basically the initiative is just showing us that, well, yet again, last week, a report from Public Health England, told us that people learning difficulties are dying with coronavirus 6 times the rate of the population. Earlier in June, another report from them said that 60% of the people who were dying of coronavirus were disabled people, and they acknowledge that the figures probably are underestimated. So these are very deeply disturbing figures, and I think I need to kind of emphasize the amazing role that deaf and disabled people have played in being the first point of call and the kind of lifeline for their communities, delivering food parcels and prescriptions, ensuring that people keeping people informed of what's going on, ensuring that people receive the benefits due to them, and the whole lot of things. And I think the other, I think funders have also responded in an amazing way to the pandemic. They created rapid response funds. They reduced the usual hurdles that organizations have when accessing funds. They have given grantees additional flexibility on how they might use their grants. Several of us are digging deeper into our endowments to make sure that there is more money around to meet needs. We are pulling resources. We are actually, and there has been an amazing collaboration, cross-collaboration across sectors. I think that has been formidable. That has been unprecedented. But I think there is a question that you ask about how can funders offer better support or support better to deaf and disabled people. And I think the first issue that we need to kind of highlight is that although there has been a lot of money there around to responding to the emergency, we really need to be aware that long-standing inequalities that have made deaf and disabled people particularly vulnerable to the pandemic could remain endemic in our society after we overcome this pandemic. And that is a very important point for us, because the lesson that we as funders need to draw from that is the urgent need to consider how we can contribute to help organizations address the system's wrongs, and how we can provide funding for the long term, and also that is sustainable, not just emergencies, just kind of looking at projecting into the long term. The second issue is that there are lots of money being given to this. I mean, this is at the point that James has dwelled upon at the beginning of his chat. And it's about the large amount of money that is being directed to organizations which are not led by deaf and disabled people, and the chronic vis-a-vis and the chronic underfunding of organizations which are user-led. I think funders have to understand and accept that the organizations that are serving women need to be led by women, and that the Black people should be at the forefront of demand for racial justice. But the message that disabled people should be controlling the organizations needs to get through in many, many quarters. So I think there's a long way to work with funders to change their mindset. And because I think this is a lot to do with, again, what Sadia was talking about, is a kind of approach of this, and James too, disability as a medical kind of rehabilitation kind of issue. And that is really, really problematic because it ignores the systemic barriers that prevent people, that hold back people from enjoying the full equal rights. So I think with funders, we need to be educated to understand understand disability as a social construction, because that would advance a narrative that centers on these deaf and disabled people as the leaders of their own organizations and their own movements of social justice. And the very last point I want to make, because it's the very first point that James made, and it's about funders, that we need to recognize that the level is not even, that the field is not even, and that achieving anything near equitable funding needs us to take intentional action to level the field. And it is within our power to take that action. And it is beyond ensuring that our ways and processes are accessible. We can adopt inclusive practices that to ensure that DDPOs, and this is deaf and disabled people's organizations, by the way, have the same entry points and the same opportunities as other organizations, because we can invest in building capacity. We can make sure that organizations become more skilled, more impactful, more influential. We can really, it is within our power to take proactive, positive action, and we should do it. How we can do it is up to individual donors. In our case, we opted for a dedicated stream with a dedicated package of support. And finally, is that the system is leaving many groups of people behind. And as funders, we really need to dedicate resources to ensure that people can catch up and they can succeed at the same level and succeed barrier-free. Thank you. I think I went too long.
No, that's perfect. Thanks, Tanya. I really appreciate it. We're going to open up to questions at the moment. As you will see, where you are all posting frantically in the chat, which is amazing. There is also a second tab just next to that says questions. If you have specific questions for the panel, can you put them in the questions bit, because I'm desperately trying to keep up with the chat and pull questions out and struggling to do that. So if you've got questions, please do stick them in that chat, because that does make it much easier for me to keep on top of it. So I think we've covered a few questions. Michael at the beginning asks for the report to James's research. We've shared that in the chat a couple of times, but I've also linked it under Michael's question, so you can find it there. I think we've touched a little bit about challenging to put it in funding bids, the principles of Nothing About Us Without Us. We've got questions on the kind of mindset and around how damaging that can be, that kind of charity model and the do unto and the managing KPIs.
Can I just comment on that one, Hannah? The question from Lawrence there. I think it's a really important question. It's something that I would have liked to cover earlier in my massive ramble. I think that sort of all of the organisations I spoke to, and all of us, I think, on this chat will recognise that there's a really important space for allies. There's a really important space for non-disabled people who are working to support the disabled community. The thing that I really struggled with was that it's kind of there's almost become a blurring of the lines, I think, sometimes, where you see organizations where they employ disabled people where, I mean, can I name an organization as an example, and I'll keep my comments balanced. I won't be for or against. Okay, so let's talk about Leonard Cheshire, who are often not looked upon that favorably by DPOs, but who you could also say have a huge footprint across the UK. They are a big point of contact for many families. They do support many families. They have disabled staff. They have had 2 disabled chief execs in a row now, I think, with the announcement that Ruth Owen will become their new chief executive. You could argue that there are elements of what you might consider, I know I might get shot for this, but you could argue that they might meet some of what you might objectively consider to be a DPO, but I think that most people recognize that they would not be considered to be a DPO. But when we talk about disabled people in positions of leadership, and when we talk about disabled people being empowered and supporting disabled people, I find it so fascinating that people look so unfavorably on the large organizations who have that big footprint, who are, for many families, that first point of contact. I mean, certainly for my family, when I was diagnosed with my impairment, their point of contact was a big national charity, and that's because they were out there with that footprint. And I guess if we start to think about wanting to fund more DPOs, which I think is, if I can be unobjective, which I think is the right thing to do, to fund more DPOs to do work around disability, then in my head I sort of wonder, well, if we take that along, does that mean that somewhere along the line, during that transition of power, are disabled people on the ground going to lose out? Is there one family that's going to miss contact with an organization that could help them during that path? I don't know. Sorry, that's not really well articulated by me. It's a thought I've been exploring back and forth in my mind, that kind of the space for allies, the value of our allies, but also recognizing that it is disabled people ourselves who need to be the ones who are empowered in this work.
I think it's a very complicated can of worms that you are about to open, James. I'm going to return quickly back to the questions, just because I don't want to kind of dominate with one thing, but more than happy to return to this. I don't want to kind of dismiss it, because I think we could talk about this for hours, couldn't we? So Caroline has said, if funders wouldn't be comfortable funding a male-led women's rights group, how can they justify funding conventional disability charities? Which I think is kind of that link in to the conversation that you've just had, James, around kind of what part do allies play, what part do families play, what does that look like? Is it about kind of like readdressing a power balance rather than necessarily kind of like funding one over the other? How does that work? It's complicated. I think we're all trying to bumble through and work out what that could be. Sadie, you've got your hand up. Do you want to come in?
Just to just a point for me in relation to why as I said earlier, some organizations, some charities that work for disabled people have been opened have been in existence for over 150 years. And since I've been involved in disability movement since 1992, we have achieved tremendous change, tremendous. You can't put it on a scale. Like say, for example, the accessibility that we fought for, it was for me, and it was for everyone that is in this room, whether they are disabled or not disabled, whether they are the future disabled people or their children or their cousins. So we, in relation to funding DDPOs, it's about what do we call for. It's not an intervention, like say, for example, Tanya talked about distributing food and stuff like that. That is an intervention for COVID-19. And I remember when Hannah asked me at the beginning about whether I want to be involved in this chat, and I was thinking about it. I was really scared because it's philanthropy, and I've grown up with philanthropy, and I fought philanthropy, and I became sort of a nerdy equality. Because of my experience. Not that I'm saying that it's really bad. Not that I'm saying that. It's about how do I achieve the ultimate freedom, the happiness that all of us are looking for or want to achieve in this world. So that's the only thing we're calling for, is being happy in this world. That's all. Okay, so for me, like say, for example, when Inclusion London asked me to deliver a training for Uber around how to provide services for disabled people, for me, I can make it short. 2 words: respect disabled people. 2 words. And we do it in 3 days. 3 days, because there is a lot of hit back. But what I'm asking for is happiness. What the cousin of the Queen, you know, the ones that been 5 or 6 have been in institutions, are asking for happiness. And when I fight for happiness, and DDPO's fight for happiness is for all of us, for the globe. It's not just a number. When charities that work with disabled people is strictly numbered, and we can't measure that. And what I'm proud of DDPOs, no matter how much funding they have, it's like I read something in their report. One person in James' report, one person can be the CEO, can be the cleaner, can be the admin, can be, and they work tirelessly, not for the change for themselves, it's for the change of others that are coming, for you and me and the other ones. It's for all of us. It's a systemic change. And sorry about taking just to think about what Tanya said. For me, I thought about monetized love. That's what I've grown up with, is monetized love. So Tanya is talking about how fragile is that. It didn't consider the black swans like COVID-19. I haven't grown up with friends, which is organic friends, organic love. So there is a hole in there. There is a space in there. Who is going to bring things to that lonely disabled person who wants to live independently? That's the thing. So we start an intervention, cure it with another intervention and another intervention, and the intervention is progressive. And I'm calling for funders to look at the impact, psychological, emotional, heartfelt impact on those charities, on me and others. Thank you. Sorry about taking a long time.
Don't apologise, Sadia. It's really, really interesting and such great challenges. And I think one that we grapple with all the time, particularly in the way that funders work, like we measure stuff sometimes because it's easy to measure. We measure kind of numbers and statistics when actually we don't have the tools or the understanding to say, how do you measure love and passion and the way that we change lives? And I think that's sometimes the difference is, particularly if you're taking like a rights-based or a justice-based approach to kind of disabled people's lives, which often disabled people's organisations do, that is so hard to quantify because it's a long-term game. It's not a quick win. It's not about X amount of people coming to a workshop or X amount of people coming to a community centre. It's about long-lasting life impacts. And we never hear about the history of disabled people and what we've contributed to communities. But if you look at the legislative changes that have come about around improving the lives of disabled people, in the whole, they are created and fought for and won, as with the majority of kind of civil rights across the world, by those people that have experienced those that oppression or those hardships. And you look back to kind of the first disability legislation around kind of the Blind Act, was that what it was called, that was created and developed by hundreds of blind people marching from Manchester to London to kind of like really advocate for that change. I suppose we've touched a little bit on in some of the chat around kind of like the role of allies and what that means, and actually how can funders step up into that role. And I think a really good example of that is the Disability Discrimination Act. The MP that put that forward was a non-disabled MP with family members who were disabled, and he kind of championed and pushed that through with the support and the backing of disabled people and disabled people's organisations across the UK. And that's now kind of like the most established legislative protections for disabled people across the UK. We can argue whether they are being implemented or not, probably until the cows come home, but that stuff comes from the disabled people's movements, and it's really interesting to see how that interacts with funding, and actually what is our part to play in that. How do we start to reimagine what we recognise and kind of like what we value in disabled people? And actually we are leaders, we are community kind of champions, we are campaigning for these rights and privileges, and not even privileges, just rights. That comes from those people. And how do funders see us? Do they see disabled people as recipients of funding and recipients of a project, or are we leaders in our own right? And shifting that mindset can help us fund in different ways, and in different ways that kind of empower communities to thrive. That's my little soapbox. Right, okay. We also had questions from Helen around, is there a role of funders to respond to major scandals and reports, such as the continued use of physical restraints? The sector having campaigned for change, but there's little commitment from central government. How do we see our role in this? James, I think you answered this question slightly in the chat, if I'm managing the two conversations.
Slightly, but I'd be happy to say a bit more about this, because this is a really interesting one for me as well. Working, funder side as well. I think that we're, as funders, we're really happy to fund stuff that is nice, that is good work, but it's really difficult for us to shift from that position of wanting to remain impartial. I think there are a couple of funders who are quite happy to have that that opinionated voice, that they're happy to say this is wrong, and we are going to fund things that tackle this. We are going to lobby and campaign about this. In particular, I'm thinking about people like Joseph Rowntree Foundation. You could also argue Carnegie do a bit of this, but by and large, I mean, for someone like the lottery, could you ever envisage a scenario where the lottery would turn around and weigh in on a policy issue, on a policy area beyond the financial? Is there ever a position where, and sorry, I don't mean to drop you in it, but is there, could you envisage a scenario where, let's say, the chief executive of the lottery stood up and said that this is wrong, and we think that this is something that shouldn't happen? In this instance, let's talk about the continued use of physical restraint in ATUs. Would there be a place where she was to get up on a platform and say, this is terrible, we're not going anywhere near anything, we're not going to fund anything that's anywhere near this space, you should stop this? Which, funders have a huge amount of power beyond the financial. It's just, it feels like there's such a hesitancy to use it sometimes. And I can understand why, of course, but yeah, it's an interesting one. Sorry.
Tanya, is that your hand up? Go for it. Oh, sorry, Nick, are you sticking your hand up as well? Or are you just signing?
I think it's just going back to funders exist to fund the activity that practitioners carry out. Some funders have options, and some funders can be much more outspoken on issues that affect their grantees. But I think the option that there is a very fundamental option for funders, and is one whether they choose to, and not for all of them, actually, for some of them. It's about the choice between attempting to support those who are tackling the kind of root causes of the problems, or actually just being quite happy with fund organizations which are kind of making problems easier to live with, to put it in a way, just kind of the casualties of the system. This is the, and in some cases for the lottery, I appreciate that you, for example, you are a non-departmental public body. Therefore, you cannot be campaigning or challenging. And in fact, when we started with our program, Strengthening Voices, Realizing Rights, you were quite excited about joining us. But then that was a major kind of hindrance. You couldn't quite join us because of the nature of what you do. But I think the fundamental choice is about whether we are allies of people who want to change the status quo and who think in terms of choices and rights and dignity and, you know, those sort of important things that are kind of attempting to address the systemic issues, or whether we want to simply fund, you know, the sort of community activities that are, you know, they're useful, they're helpful, but they don't change the way things are.
Yeah, I think it's a really difficult line for particularly the lottery to tread, because we are spending public money. We're kind of like a public funder. That's what we're distributing. So we find it very, very difficult. The campaigning side of things, that is tricky for us. And many of you, I'm sure, have kind of like attempted to access funding for that type of work and have had pushback because of the way that we are set up, the parameters in which we fund, the kind of like legislative kind of like parameters and governance that kind of sits above us. But I have to say there are lots of different funders funding lots of different spaces. So there's funders that specialises in rights, there's funding that specialises in campaigning, there's limited funders that are specialising in around the disability sector, which I think is probably something that we should be talking about as a collective, around actually where are the pots of money specifically for this, where are they coming from, and Trust for London is the kind of the key example. And if there's only one, there's probably something that can be done in that space. I think going back to the question Caroline had around the kind of physical restraints, I think there's a difference between kind of a policy ask and a safeguarding issue. And we have safeguarding processes and protocols that are in place across all of our funding. So if people are having anything to do with safeguarding, there are ways of flagging that, of whistleblowing, of kind of reporting that to us. And that is a different situation. Obviously there's overlap in all of that, and it relates to policy change, but that would be the way that we would kind of want to support and respond and to anything in that space. So please bear that in mind. Sadia, you had your hand up just then. You're on mute.
Just a quick one is why those, you were talking about those groups that fund maybe lobbying and stuff, but they're not looking at disability. Is that did I understand you right? You're mute now.
You'd think after 6 months of being on a video conference, I'd be able to mute and unmute. I still can't manage it. Sorry, Sadia, can you say that again?
Did I understood you right when you said about other groups that fund lobbying and campaigning, they don't look at disability issues?
So I don't know personally of any specific campaigning disability fund apart from the stuff that Tanya is doing. There are other organisations that fund, so you might have heard of the Edge Fund, which is an amazing participatory grant maker who funds campaigning organisations, and they fund disability organisations within that, but it's not a specific pot for disability campaigning, it's a pot for campaigners.
Okay.
Organisations across the board. So they also fund things in kind of migrant rights, in kind of anti-racism work, against police brutality. So it's a whole array of different things, and they do that in a way that allows the different grant holders to come and learn from each other. So it's not just a specific pot on disability. They can come in and access the funding, but they will also discuss and learn from others in a different space. James, go for it.
Sorry, after this I'll stop because I know that there are other questions we don't want to drag out too much. We'd also point out Open Society Foundation fund lots of campaigning work. The thing that I find really interesting about the lottery is that it is the UK's biggest funder. I mean, it dwarfs other. Sorry, go on.
Sorry, James. I missed the name of that. Sorry.
The Open Society Foundation. They're international. Yeah, the thing about the lottery is that as the biggest funder in the UK, you've got tremendous resources at your disposal. I think that one of your colleagues has put in the chat the point about funders being able to platform good work, about being able to fund people who can advocate and create systemic change. And it's really something that I would like to see the lottery do more of, to fund more of that systemic change stuff, because otherwise all we're doing is just perpetuating the inequality. We're tinkering around the edges, when really I think there is a strong case for some bravery around wanting to tackle certain structural issues. You could take, as Helen has raised in the chat, the issue around assessment treatment units as one example. That is something that I think most people would agree is clearly wrong, is clearly an injustice. That could be the lottery's gateway drug into tackling other kinds of structural and systemic inequalities. Because otherwise all we're doing is just allowing things to perpetuate. We're slapping a band-aid on when someone's already fallen off the cliff.
There are different ways that we fund at the fund, and some of that is systemic, but a lot of it is around kind of like community work, and we use people in the lead as our strategic approach. So it's that kind of like, it's the balance of those two things, because actually they both need to sit simultaneously, which can sometimes be hard. But I'm going to move us on just because we've got 10 minutes left, and there's one last question that we haven't covered. Two more questions that we haven't covered. One from Michelle Daly from ALFI, which is the Alliance for Inclusive Education. Have I got that acronym correct? Yeah. Michelle says, if we properly resource DPOs, then we can build capacity and create change makers. Can you tell us what work is being done to tackling institutional segregation of disabled people that get masked under the auspice of special needs services activities? Does that make sense?
Could you repeat that? Sorry.
Michelle Daly from ALFI, if we properly resource DPOs, then we can build capacity and create change makers. Can you tell us what work is being done to tackling institutional segregation of disabled people? I'm going to leave it there so that I don't have to say the last bit that I can't pronounce. Any takers on that question? Go on, Tanya, you're muted.
Hello, Michelle. We funders. I mean, I made the point earlier. I think it is for people working in the field to bring these issues to attention of funders so that they get supported to combat it. Funders are not. Very few funders are operational and develop projects in the field. Some do actually, but very few in the UK do that. But I think it is your job as a campaigner, ALFI's job, to actually bring these issues to the forefront and actually make sure that funders get wind of the issues and they support you to campaign over the issues you set out to campaign. I think I mean, it's about. I mean, for me, the most important thing here is educating funders on the issues and also on the kind of nuts and bolts and the practicalities of inclusive funding. And inclusive funding is a different concept to the funding that goes on, as a matter of fact. And I think we just need to create much more forums, more conversations like this, so that we can share experiences and fund. And listen to the field and listen to the issues, because we're not practitioners. We do not know what's going on necessarily unless you bring that to our attention.
Brilliant, thank you. There is one question from Michael, but I don't think that I understand it particularly. So I've just asked you to read. James,
I'm not entirely sure I fully understand either, but I would say that I think it's a good challenge from Michael to ask ourselves.
Challenge, just in case people haven't read it.
Sorry, Michael's question is that please don't overcomplicate the subject of equity. And his question is, how will this conversation sound in, let's say, 5 years' time? I think it's a good challenge to always think about how these conversations will be looked upon.
Sorry, James.
Sorry, Nick. Do you want me to repeat?
Sorry, James.
Yeah, I think it's a good challenge from Michael. I think it's very difficult. I would contend that actually the subject of equity is really complicated, and especially if we start to get into talking about power, the distribution of power, and the sharing of resources. That is a really complicated and messy subject. I think the desire to take an equitable approach is simple enough, but pulling it into practice is really complicated and messy. And I suspect that in 5 years' time, we'll still be arguing over this, depressingly. But I do also hope that we'll have made some movement on this. Sorry, Michael, if you want to come in, I'm probably getting that entirely wrong. So feel free to come back and correct me.
Thanks, James. We have 5 minutes left, so I'm going to kind of wrap us up now. I think we've predominantly covered all of the questions. I just kind of want to highlight some key things that have come out of the conversation so far. So we've really highlighted, all of the recommendations from James's report is something that funders should be kind of taking away and thinking about how we embed this within our own practice and more systemically across the organisations that we work with. I think we've talked and touched on kind of flexible funding, kind of how funders recognise and support disabled-led organisations, because I think there is a challenge there for us around when we end up with an application, like, are we able to establish whether it's user-led or not? What are we looking for? What questions are we asking? How can we be more act with more care and more deliberation and more reflection through that process. We've talked about core funding and how we access that, the added costs of a disabled-led organisation. If you are a CEO doing the cleaning and the washing up and the admin support and the strategic direction, how do we build in the space for those organisations to kind of like breathe and then thrive? We've talked quite a lot about equity and this concept of like different, the same, one size fits no one. And if we work in a kind of an equality framework of everybody goes through the same process, what it does is it kind of disenfranchises and puts up barriers to organisations that need that flexibility and that different approaches. How do we as funders respond to that and create that? Sadie has made some incredible points about, I really enjoy the concept of kind of radical empathy and what that looks like, particularly in a funding space. How do we measure love, passion? How do we kind of like celebrate and fund in that space rather than reverting to things that are easy, rather than the things that are doing long-term good? We've talked quite a lot about kind of respecting and recognising the skills and the contributions that disabled people make, and not making assumptions if you're not a disabled people about what we are able to achieve and deliver on. Finally, it is the beginning of Disabled History Month today, so please do spend some time the rest of your day learning, exploring, researching what is out there, what has happened, because we probably weren't taught about it in schools. So that is a kind of call to action for you personally today. I want to say huge thank yous to the panel, to Tanya, Sadia, James and Rianne. It's been incredible to kind of like get into the conversation, discuss and delve into some difficult, tricky, interesting, simple ways that we can kind of approach this moving forward. Nick, I want to say a huge thank you to you. It's been wonderful having you here. We really, really appreciate it. I also wanted to say thank you to the other contributors to James's report. So James spoke to people across the whole sector. He spoke to funders, staff internally at the lottery. He spoke to a whole breadth of different people. Thank you so much for your insights. Also, thank you to the illustrators for that report. So we had, I think it was 2 disabled illustrators that were involved in the art that created that work. Kitty Strand is one of them and was on the chat earlier. If you're interested in involving more disabled creatives in your work and how you do things, please check her out. She's got a great Instagram shop. Anybody else that I've forgotten? Scott, thanks for organising the tech. Because it was a nightmare to begin with and you fixed it, so appreciate it. Any final words from anybody else on the panel in our last minute?
Thank you, National Lottery and James for bringing this issue to be discussed. That's one step for radical.
One step.
One of the steps. The starting step for radical empathy and radical friends to equality from me.
Thanks, Nadia.
And equity, both. Always a fighter.
Yeah. Thank you all for listening to our ramble. Yeah, it's just been a real privilege to work on this, and I'm glad that it's been of interest to at least some.
Brilliant, thank you.
Thank you for having us here.
Perfect. Well, bang on time, 11:30. Nailed it. Thanks, everybody. Really appreciate you coming. Bye.